I would say that right now the two major advances in the treatment of spinal conditions, number one would be minimally invasive spine surgery, and that refers again to a philosophy or a new paradigm shift in the way that the actual operation is done. And specifically that means trying to minimize amount of soft tissue injury to the surrounding structures by the spine as little as possible. The number two advancement or the number two paradigm shift in the treatment of spinal conditions is motion preservation surgery. Traditionally, whenever we have had to treat various spinal conditions such as neck pain or back pain, the treatment has really been stabilizing the spine by taking movement away from the area of spine that we think is the pain generator or the part that is causing the pain. That's known as spinal fusion. We can think of it easily as if we were to have, let's say, a broken femur, the way that the surgeon would traditionally treat it would be to put it in a cast, take motion away from that area to allow that area to heal. The upside is that it can treat the fracture, potentially take the pain away. What is the downside is that if we were to fuse a segment in our spine, it would mean that it would make our neck or our low back less flexible. Most people don't realize this, but our spinal column is actually a bunch of joints stacked on top of each other. This is a model here that shows really one segment in our low back, in our lumbar spine. As you can see, the spine actually is composed, the spinal segment is composed of many different joints. One joint is actually at the disc space, which people traditionally think of the cushion part of the spine. And the other part of the joint is actually in the back of our spine, and that has to do with the facets or the joints in the back of our spine. If you notice, whenever we move, whenever we twist from side to side or bend forwards and backwards, we are getting motion at all these various joint areas. Now, whenever we do a fusion surgery, we are taking motion away from this area. What that means is that, number one, it will make our neck or our low back more stiff. Humans are really built to move. The less we move, usually the less happy we are. And that's really the basis for the motion preservation operation. The other concept behind motion preservation surgery is that you try to minimize the amount of stress that the segments near where the fusion would happen are going to endure. Because if you think about it, if we have 5 different areas in our low back that would normally move to allow us to bend from side to side or forwards and backwards, if we were to fuse 1 or 2 of those segments, those remaining levels that have not been fused are going to unconsciously take over the added stress of those other levels. What this would mean over time is that they would have more wear and tear, and that means that they have more stress, and what happens is a concept typically known as adjacent segment disease, which means the areas above or below the level of fusion, because they take on more stress, they tend to wear out a little bit faster than they would if they were not above or below the fusion areas. Therefore, this motion preservation technology, now known as artificial disc replacement, will really, what it allows us to do is, number one, somewhat stabilize the area where we think is the pain generator in the spine, and at the same time still allow that person to preserve a significant part of the motion that they had previously. There's a lot of data now that is coming out. Most of the data has been in Europe, where the artificial disc devices in the neck and the low back have been in use for a number of years. And as more data comes out, we are getting more encouraging data. Personally, I have also had a number of patients who really have had life-changing experiences once they have had these surgeries. Now, again, as I mentioned before, just because an operation is available, it doesn't mean that every patient would be a candidate for the surgery. The selection for this operation really takes a lot of evaluation. The patient has to really be the right candidate, because if they are not the right candidate, again, not only the operation would not help, it can actually cause the patient harm.